Welcome to the media briefing today. Today, we have Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Sarah Ho, Chief Manager of the HA. Now, Dr. Au, please tell us the latest situation. Good afternoon, media friends and members of the public. Now, I would like to report CHP's latest information concerning yesterday. Yesterday, we had 13,335 cases tested positive on PCR. Case numbers are 610307 to 623641. Among them, 1,463 cases were confirmed by the HA. 3,136 were confirmed by the Public Services Laboratory. The remaining 8,736 cases were confirmed by the private laboratories. Among the 13,335 cases, 3 were imported. The remaining 13,332 cases were locally infected. In terms of genome sequencing, yesterday our Public Services Laboratory have performed genome sequencing on 3,136 samples. No strains concerning L452R were found. 793 cases were confirmed to be negative for the L452R strain, that is the Omicron strain. The remaining 2,343 cases, analysis is still ongoing, or the viral load is insufficient. In terms of RAT, on the 12th of March, we had 19,095 reported cases which were confirmed. The total number for yesterday, that is the 12th of March, is 32,430 cases, including 13,335 cases tested positive on PCR and 19,095 found via RAT. So far, in the fifth wave, we have 694,246 cases of positive cases. For care homes, yesterday we had 4 additional care homes with infection, including 3 RCHEs, that is the care homes for the elderly, and 1 care home for people with disability. Altogether, 86 cases, 71 were residents, and 15 were staff members. So far, for care homes, we have recorded 745 care homes with infections or outbreaks. Among them, 368 centers had infection in the past 2 weeks, accounting for 46% of the total number of care homes in Hong Kong, involving altogether 26,300 residents, accounting for 30% of the total number, and around 6,580 staff members infected, accounting for 22% of the sector. For RCHD, 266 care homes for people with disability have seen outbreaks in the 5th wave. Among them, 143 experienced infection in the past 2 weeks, accounting for 42.7% of the total number. In this wave, for RCHD, there were some 6,980 residents infected, accounting for 38% of the total number. Also, 2,500 staff members were infected, accounting for 23.6% of the total. For fatal cases, death cases involving care home residents has risen to 2,061. The total death toll in the 5th wave, as at yesterday, was 3,780. An increase of 264 cases compared with the day before. The fatality rate has risen to 0.54%, involving 2,344 males and 1,446 females. The age ranges from 11 months old to 112 years old. The median is 85 years old. We had 5 fatal children cases and 165 adult cases, accounting for 4.4% of the total death number. For those above the age of 60, the death cases has risen to 3,603, accounting for 95.3% of the total number. For those above the age of 80, the number has risen to 2,648, accounting for 70% of the total number. In terms of vaccines analysis, among the death cases, 89.4% of the deceased were not vaccinated or only vaccinated with one dose. For those among the age or above the age of 80, 91.5% of the deceased patients were not vaccinated or just received one dose. For those who have received only one dose or no dose at all, the death rate is 2.03%. Compared with the fully vaccinated people with two doses, the death rate is 0.09%, and there is a difference of 23 times. For elderly people above the age of 80, for those who have not been vaccinated or just vaccinated with one dose, the death rate is as high as 12.7%. Compared with those elderly people with two doses, the death rate is 3.12%. The difference is 4 times. Now, Dr. Ho, please tell us about the HA situation. Good afternoon. At present, 10,601 patients or preliminarily confirmed patients are receiving treatments in the public hospitals and North Lantau Infection Control Center, the CHP's Infection Control Center, and the AWE Community Treatment Facility. Last night, we reported 89 patients in critical condition, 114 patients in serious condition. 101 critical patients are receiving treatment in ICUs. As at 0 hours today, in the past 24 hours, 190 patients tested positive with COVID passed away, involving 112 males and 79 females. The ages range from 39 years old to 105 years old. Among those deceased patients yesterday, 115 were from institutions or care homes. 124 patients had no vaccination record. 46 patients received one dose. 20 patients received two doses. 175 patients were above the age of 65. Among them, we have several younger patients. One was a 39-year-old male. He was a resident at a care home. He had developmental delay and epilepsy. He was wheelchair-bound. He was a person carrying high risk. Unfortunately, he passed away yesterday. And also, we had a 43-year-old male, a 50-year-old male, a 52, 57, and a 59-year-old females. These patients had a record of cancer or serious chronic illnesses. They were all from high-risk groups. And because of the backlog, today I have to report some death cases between the 27th of February and the 11th of March. 74 patients passed away, and we haven't reported them. They were 44 males and 30 females. The ages range from 55 to 102 years old. In the past day, 741 patients were discharged. And also, some 20 patients were found to be positive on admission screening or during admission. Some 30 patients sharing the same ward are classified as close contacts. For our staff, 14,642 healthcare workers are confirmed. Among them, 6,754 colleagues have returned to the positions. That's all for my reports. Thank you.
And I'll throw the floor open for questions. Please identify the organization you represent. The lady over there to the left, please. Now, TV. The scientific committee just announced the 2 BioNTech plus 1 Sinovac. Is this for ordinary people or for the recovered people? If I have had 2 BioNTech shots. Should I take the 3rd jab? How soon will this new recommendation be in place? In this morning's press conference, there is a mention of the monitoring mechanism for those in isolation. Who is this mechanism meant for, and when is it going to be used? Now, how is it going to be related to the PSSC, and how soon, how much manpower will be needed? And for the 50-year-old male who needed liver replacement, he has liver failure. Has he taken any proprietary Chinese medicine? Thank you for the question. Regarding vaccination, yesterday the Joint Scientific Committee under the CHP, together with the expert committee, had some discussions regarding the vaccination program. They had regard to the pandemic situation in Hong Kong, overseas experience, the WHO recommendation, as well as scientific data before making the recommendations. Basically, after infection, how many shots should be needed, and also the intervals between jabs, and the interval will have to do with the different age groups and whether they have had any vaccines before and which type of vaccines would be given, and the immunity and so on. Based on these, they made the recommendations. The CHP has already released a press release. All the detailed recommendations are contained in the press release. If someone has been infected, according to the experts, based on the scientific data, the infection can be regarded as the same as one shot, because the infection itself would generate some immunity in the body. So if someone has not been vaccinated before the infection, one can have 1 or 2 shots depending on the age brackets. If before infection, if one has had 2 shots, then there is no need for a 3rd jab. As to BioNTech and Sinovac, the committee has regard to the COVID situation over the age of 3. If one goes for Sinovac, there is a need for 3 shots, BioNTech 2 shots, and that will complete the vaccination program. The scientific committee earlier suggested that for BioNTech, after 2 shots, it is recommended that a 3rd shot would be necessitated as a booster. So in terms of the number of shots, and all these recommendations remain pretty much unchanged. The second question, will you please repeat that for me, please? Speaker not speaking through. Well, yesterday, the scientific committee made the recommendations regarding those who have been infected. The government and the CHP will be making the arrangements for those who have been infected before to proceed in accordance with the scientific committee's recommendation and get the jab. Dr. Ho, about the observation mechanism, there are some infected people who have already received the SMS, and there's going to be a link in the SMS, and through the link they can get access to the observation mechanism, and they can register themselves. If they have any particular symptoms, they can fill out the information. The system will, depending on the symptoms, make available the health advice, and there is any information that would be helpful to the patient who is in need of the information. And when filling out the information on day 6 and 7, we remind them to update the RAT test result, and things are in progress, and we will be bringing the public up to date as and when we have the information. As to PSCC, patient support call centers, Now, for patients that are in the high-risk category, the nurse will be teasing out these cases, and we will be ringing up the patient to find out how they are and make available the relevant information. And if there are any changes to their health conditions, we would provide the relevant information to them. There are certain patients for which the information cannot be made available in the interest of privacy. The gentleman in front, please. Phoenix TV. If I may ask, the positive number has been hovering around 20,000, 30,000. And how long do you think this number will remain for? It is said that HA is trying to retrofit the ventilating fans, and half of the wards will be turned into COVID wards, and this will be completed this week. And what is the progress so far? And starting next week, the number of designated clinics will hit 23. What is the demand at the moment? Will the manpower and the vehicle fleet be sufficient to cater for the demand? Right, about the daily COVID numbers, as you can see over the past couple of days, the numbers have been hovering around 30 plus. Each day, the numbers are fluctuating on a daily basis. Today, we have seen a rise of 5,000 compared with yesterday. But basically, each day, the number hovers around at a high level to the tune of 30,000 each day. We haven't seen any particular increase, but at the moment, looking at the daily caseload, the COVID situation is still pretty active, and it is pretty transmissible. In the next couple of days, we would anticipate that the number would be around the same level. After some time of hard work on the part of the members of the public, they maintain social distancing. The COVID situation is under control for the time being. We haven't seen any exponential upsurge for the time being, but we can see that the situation is really fragile, and unless we can see any obvious change for the better or any particular downturn, which we haven't seen, we have been having all these high numbers so far. People should not come away with the impression that the COVID situation is already under control, because if we slacken our efforts, there's a likelihood of a rebound. In overseas experience, this also happened before. The COVID situation might stabilize, and the COVID may become rife again after a while. So we have to maintain our vigilance. Let me repeat the numbers. As of 000 over the past 24 hours, we have 190 patients who passed away, 112 male and 28 female, ranging in age between 39 and 105. Now, you asked the question about the retrofitting work and the ventilating fans and the progress thereof. About 70 or 80% of hospitals have been retrofitted with the ventilating fans, and this will enable the hospitals to take on the COVID patients. Some hospitals have already completed the retrofitting program. We like to make it clear that by turning 50% of the ward into COVID ward, we're talking about the acute hospital.
Or should I say 50% of emergency beds. We would like to convert 50% of our emergency beds to take up COVID patients. And about designated clinics, as said today, the 17 designated clinics has received 42,000 patients. and provided a consultation to them. Now we are monitoring the situation. Depending on the demand, we would adjust the service provided. Next question, please. Good afternoon. I'm from TVB. Just now, you mentioned that the daily case number is lower than before. However, we are seeing a lot of people on the streets and in malls. So how would you, what do you think? How do you think the epidemic will develop, and what advice do you have for people? For care homes, have all infected elderly patients been sent to isolation facilities or hospitals? Are there any elderly patients still remaining in care homes? And afterwards, would you send the elderly patients back to the care homes? Now, the situation is very serious. For the past week, every day we had some 30,000 cases each day. That is a very high level. Compared with early March, we had 50,000 cases per day. The number is indeed lower. However, we are still having some 30,000 cases per day. It shows that there are numerous transmission chains in the community, and also we are likely to see a massive outbreak at hotspots like infected buildings. And from sewage samples and RTD, we have found a lot of cases. In the past 2 or 3 days, the positive rate from RTD operations exceeded 10%. So we have to remain vigilant. Do try to stay at home, and if you must go out, wear a mask and do a test if you have symptoms, and try to and do stay at home if you are tested positive, and also report to CHP as soon as possible. And then we would issue the isolation order and arrange for delivery of anti-epidemic kits as well as RAT. The HA's Community Elderly Services Assessment Team has stepped up our services. We have enhanced our outreach services as well as tele-consultation and telecare services. This will help us provide emergency and better services to patients in need. We are also following our clinical guidelines and clinical conditions of patients and prescribe oral medication for patients. For patients in more serious conditions, they will be admitted to hospital. If patients' situation have improved and if they are stable, and if the situation at care homes allows it, we will arrange for the patients to return to care homes. If the situation or the environments in care homes are not suitable, then we have community isolation facilities to temporarily house the elderly patients. Sorry, the speaker is not coming through the mic. Next question, please. The lady in the front.
SCMP News. I'd like to ask, now that positive cases through the RAT test have been on the rise for the 3rd day in a row, what does the CHP have to make of that? Do you see more upward trends with more people reporting positive through RAT tests? And second question is on, earlier it was mentioned that 101 people are in ICU. Does this mean that the HA is short of beds for the ICU units? And my third question is on, earlier on, the government has released a COVID-19 vaccination recommendation for people with previous COVID-19 infection earlier. And in the document, previous COVID-19 infection is defined by someone with like documented history of the positive test through the PCR and the RAT test. Can we have more elaboration on what can the documented history mean? Does it mean that, you know, for those who have tested positive through the RAT test, do they need to show the photos of them their RAT positive test, or do they need CHP documents or doctor's note to prove that they are previously infected by COVID-19? And does this also mean that for non-fully vaccinated people who tested positive through a RAT test and have not uploaded their results to the platform, must they now upload their results to the platform, or else they will lose the vaccine pass exemption and have to be vaccinated according to normal requirements? Thank you.
Thank you for your question. I will answer the first and the last question. For the first question on the daily number of RAT positive cases, there will be daily fluctuations from day to day. So we need to look at the overall trend over a longer period of time, say for example a week's time. And also we should not only look at the RAT positive result, we need to combine both the PCR positive result as well as the RAT results, so as to have an overall picture of the actual situation. Because as recently, more and more citizens or the general public are using the RAT for testing, so there will be increasing. This might lead to an increasing trend of positive RAT as compared with PCR tests. So when we assess the situation, we will look at the combined figure, both the RAT as well as the PCR, so as to have a more comprehensive picture of the situation. So in the last 1 week, combining both the RAT and the PCR tests, there were about 30,000 cases per day in Hong Kong. So we did not observe an increasing trend, but however, the number of cases remains stagnant at a very high level, and that means that the community transmission and the activity is still very high, and we need to observe for maybe a few days or a week more to see if there is any turning point at this moment. Regarding the scientific committee recommendations, it is the Joint Scientific Committee defined the previous COVID-19 infections as a documented history of positive tests for COVID by either PCR or rapid antigen test. So both tests, both RAT and PCR, can be regarded as confirmed cases. But however, as the government has we only record or recognize RAT positive cases as confirmed cases since the 26th of February. So according to the latest recommendations, PCR tests will be regarded as confirmed cases, and only those who were tested positive by RATs on or after 26th of February will be recognized as confirmed cases by the CHP.
So I take it the ICU occupancy now is around 85%.
So we have launched a platform for people to report their positive RAT tests to the CHP. So after the announcement of the government that RAT positive cases were regarded as confirmed cases on the 26th of February, so people who has been tested positive by RAT on or after 26th of February, they could report their positive RAT test to our platform and also submit the documents for verification, and we will assign case number as well as issue an isolation order or a certificate to them to prove that they were confirmed COVID-19 cases.
下一題，後邊白色衫嗰位女士。
One in white at the back, please. Cable TV. After 2 shots, if one is infected, there is no need for a third jab. Now, if one tests positive using RAT, if it has been issued an isolation order, can it be exempted from the third shot? And for the designated clinics, other than making arrangement to see a doctor. Can someone just get a medication without seeing a doctor? Would there be any oral medication prescribed for them? As to the certificate, if someone tests PCR positive, then the CHP will regard this as confirmed case, and we would issue the isolation order as regards RAT tests since February 26. If someone tests positive using RAT, they will also be regarded as positive. For those who test positive using RAT after February 26, we encourage people to declare on the platform. They have to upload their proof of identity. Once verification is done, then we will regard these people as confirmed patients. All confirmed patients will be issued with the isolation order. There were some who didn't get hospitalized, or there were some delays in the issuance of isolation orders. We would get in touch with them and issue the relevant documentation to confirm that they were infected with COVID. As regards the vaccine pass, the FHB will be making the announcement later on. Speaker not coming through. The vaccine pass, the FHB will be making the announcement later. For high-risk patients, if they turn up at the designated clinic for medical attention, and if the quota has been filled, then the patient can seek to collect medication. This medication is for the relief of the symptoms. Depending on the clinical guidelines, the designated clinics later on will be prescribing the oral medication for COVID for the patients. If necessary, people can also call the hotline, and it is 1-836-115, 1-836-115. If necessary, we can make referral to the doctor for telemedicine, and people will be getting consultation via telemedicine. There are 100 lines on this hotline for consultation. Gentleman at the back, please. AM 7:30, about the vaccination program for recovered patients. Let's brush aside the vaccine pass. People may need to have proof of recovery for their employer. Online, there are some rumors that the recovered patients should get the exemption, vaccine exemption from the GOPC. Now, how soon will the government be making the announcement regarding the exemption for vaccination? If people turn up at the GOPC, would that cripple the GOPC? Also, QEH and Fung Yue King Hospital, what is the occupancy rate for COVID patients? Dr. Au said before that for people with mild symptoms, they may have recovered without realizing it. If people have the immunity as a result of infection, will these have any implications on these people in terms of the vaccine program? Will there be any blood test to prove whether they have the immunity in their body? Thank you for your question. On the first question, there is no need for any vaccine exemption certificate. The scientific committee has made a recommendation having regard to the overseas experience, the scientific data, and so on, and made the recommendation regarding the recovered patients and the vaccination program for them. For those who who are unvaccinated after infection, people can have 2 shots. The scientific committee had some discussions. After infection, it would be tantamount to having been given one jab, and so after recovery, 2 more shots will be required. We are talking about people with a normal immunity. For those who are immunocompromised, the scientific committee has also made some recommendations. If people would like to get the vaccine, they should know whether they are a recovered person. If they have been infected and recovered, they should proceed in accordance with the scientific committee's recommendation. In terms of the vaccination, it all depends on the age bracket, the immunity level, and the types of vaccines one goes for. We understand that some people have tested positive and they haven't been hospitalized, nor have they been sent to an isolation facility, and they cannot get the isolation order. Later on, we will be making the arrangement for the proof to be issued, to prove that they are recovered from COVID. Now, for COVID, some don't have any symptoms. Some have mild symptoms. They never got tested. We suggest that these people don't have to test the antibody for the purposes of vaccination, and there is no such need for them to do so. And the test may be inconclusive. So if people have never been tested to be positive using PCR or RAT, they can regard themselves as someone who's never been infected, and they can proceed with the vaccination program in accordance with this. For the QEH, they have completed all the process for being converted into a COVID hospital. According to our clinical guidelines, some patients have been arranged to be discharged, or some of them have been transferred to other hospitals to free up the beds for COVID patients. For some patients that are not suited to be transferred, they would stay in the hospital for treatment. The hospital will retain a certain number of beds as a buffer to cater for some non-COVID patients. In order to tie in with the arrangement of designated hospital, the A&E ward will only take serious non-COVID patients. Fung Yue King Hospital, there are 260 beds that can cater for COVID patients. They are progressively admitting COVID patients. Next, please. Lady in front, please. HK01. 2 questions, if I may. First, Hong Kong Zhuhai Macau Bridge Artificial Island, the isolation facility came into operation yesterday. How many people have moved in? This question is for HA. QEH is a designated hospital, and there may be some non-COVID patients that are admitted that are critical, and this is compounding the workload of the A&E department. There are long queues in many of the A&E wards in many hospitals. How are you going to improve the situation?
On designated hospitals, the idea is offering focused treatments, default focus. Focusing on patients, focused manpower, focused resources, and treatments for patients. We have lots of non-COVID patients to care for. So we are going to convert 50% of our public hospitals' beds to take COVID patients and to handle the epidemic. The last question, please. Good afternoon, doctors. Ming Pao Daily. Dr. Au, for those who tested positive on RAT before the 26th of February, they cannot register on the online platform, so will they be given a certificate for them to comply with the vaccine pass requirements? Would that be additional proof for them? If there is not, how can they be exempted from the requirements to get the third jab? Now, concerning the vaccination recommendation for recovered patients by the scientific committee, what if the recovered patients choose not to get a jab, and also will the jab's efficacy be affected? And HA, how many COVID patients are staying at QE? Now, the designated clinics are going to prescribe the new oral medications this week. So how many doses will be available? Thank you. On RAT positive results, the government made an announcement on the 26th of February that positive RAT results will be recognized. The CHP has launched an online platform to enable patients tested positive on RAT on or after the 26th of February to register online. Identification documents will have to be provided, and after confirming the documents, the patients will be confirmed as patients. Prior to the 26th, we relied on PCR test results for confirmation. So we understand that many patients tested positive on RAT before the 26th of February would go to get another PCR test, and they were confirmed via the PCR test. So they would be deemed as positive cases. And since the 26th of February, those tested positive on RAT would submit their results online and submit the relevant documents, and then they would be treated as confirmed cases. Having had a discussion yesterday, the Joint Scientific Committee made a recommendation on vaccination of recovered patients as well as the interval of the jabs. So we advise members of the public to follow the recommendations made by the Joint Scientific Committee in getting vaccination. For the Queen Elizabeth Hospital, 1,300 beds were converted to take COVID patients. I don't have the occupancy rate right now. That's the end of the media briefing. Thank you. No, they won't be. Sorry, the speakers are not coming through the mic. Sorry, the speaker is not coming through the mic. For recovered patients, they should follow the most updated guidelines or recommendations made by the scientific committee. If they do not have a test, then they can be treated as non-patients. You don't have to get an antibody test to find out whether you have been infected. That's the end for the briefing. Thank you.